Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we're having another installment in our exciting series entitled Tales of a Family Caregiver. And we have our sparkling guest, Dr. Gloria Donnelly, who is joining us again. I want to tell you a little bit about Dr. Donnelly, and then I'll tell you about our show. Dr. Donnelly is a well-respected healthcare professional in the Philadelphia area. She's Dean and Professor of Nursing and Health Sciences at Drexel University. She has a stellar career and has been very, very involved in healthcare issues for many years. She is the author of 4 textbooks, and she is the editor of Holistic Health Nursing. She has really made her mark, but not any more so than she made her mark by taking care of her elderly parents at home. She and her husband, Joe, took care of her mother, her father, and her mother-in-law. They decided not to really have these people go into any institutional care and were able to take care of them at home successfully until they died eventually at very advanced ages. So I want to welcome Dr. Donnelly back to be with us again. She is really, from her own experience, such a great tale teller of what it was like and how they solved the problems as they went along. So today, our show in this installment is really very important because it's part of where people get frustrated and stalled in this process. So what we're going to be talking about today is maintaining relationships when the filters are gone. And what that really means is that many times as people are advancing in their age, they are having signs and symptoms of dementia of some magnitude. It may be less in some people and certainly much more profound with others, but those filters really change their behavior.
Yes.
And that is what we're going to talk with you about today. So specifically, we're going to get involved with how past relationships and how you have related to people in the past really are going to still be maintained in a different way going forward. And we're going to talk about that and what happens when dementia is progressing. We're going to talk about this unfiltered idea and what happens socially when people do not have the same social filters and how that changes the interaction. We're also going to talk about the tips involved in reminiscing. Reminiscing and really recalling the past can both have its upsides and its downsides, and we're going to talk about both of those. And then we're also going to be speaking about dementia can be in the eye of the beholder. Lots of people don't want to believe that they have dementia, or some caregivers don't want to believe that their family members have dementia. So often that will be where people will be basically denying the reality of that. So we'll talk about some of the examples, and we'll be talking about exemplar behaviors of things that you can do if you are dealing with any of these problems. So Gloria, again, thank you for joining us. And I think this is a very, very important topic because this is really where I think caregivers can get very frustrated.
I think probably of all the things we will discuss about dementia, this is probably the most important topic. And I say that because even though someone is experiencing dementia, they are still your mother, your father, your mother-in-law. You have a history.
Right.
And you have a way of relating to them that that colors the way you will relate to them through their whole dementia process. For example, my mother-in-law and I were always friends. So, and she always sided with me.
Oh, that's a real plus.
That is. And so when my mother-in-law moved in with us, of course she was fine for the first, I'd say, 13 years. But at the end, maybe 6 months before she died was when the dementia really kicked in. Mm-hmm. My mother-in-law saw the world through a very rosy lens. And it was interesting, she never believed that my mother really had dementia, even though of all 3, parents, my mother's dementia was the worst. But my mother-in-law and I were close. We would talk about, she was a great storyteller. And she would talk and talk and talk. And I used to like to listen to her stories, but my husband did not, because he had heard them all at least 25 or 30 times. But I like to listen to her stories. Though when, at the end, when she was having her sleeping problems, I went in her room one night. She was having a very difficult time sleeping. She was very agitated. And my husband had been in. He couldn't do anything. She was yelling. She didn't want us to sleep if she couldn't sleep, which was not like my mother. And so I said to my husband, I'll go in because, you know, I'm the nurse. I'll take care of this. So I went in and I sat on the edge of the bed and I said, Mom, I said, you know, you've been yelling for a long time. It's after midnight. I said, we all really need to get some sleep.
Right.
I mean, do you think you could just kind of lie back? Do you want me to get you a cup of tea? Is there something I can do? She kind of growled at me. No. Now that was not my mother-in-law.
Right.
So how do I respond to that? And I said, well, let me try this tact. I said, you know, Mom, Joe really needs to sleep, and I do too because I have to work tomorrow. She said, too bad.
Wow, she was really twisting the knife.
And finally I said, Mom, I said, you know, Dad's right across the hall, and he needs to sleep too. And she said, your precious, precious father. And I thought, oh my God. And I stood up and I said, well, Mom, is there anything I could do? And she looked at me and she said, my husband always said, never trust Italians. Now, my mother-in-law, my husband and I had been married 40-some years. My mother-in-law and I were best friends. But that filter was gone. That maybe back in her history somewhere, I think it was probably related to her father. You know, the Lithuanians didn't like the Italians, and then she married an Irishman, and all of that was coming out. And I think that happens in dementia. And unless you roll with it and can laugh at it, you can get very upset.
Right.
And it really can put you in a very compromised position if you take things like that very seriously.
Right. But, you know, with your knowledge and background, because Dr. Donnelly is a psychiatric nurse, so, I mean, having those really gentle, soothing, sort of open-ended questions, it basically didn't work.
Nothing. And I think that's what you have to realize. You could buy all the books at Amazon about dementia, and some of them are very good. You could visit every website there is, but your experience will be unique.
Right.
Because your relationship with your loved one is unique and has a history, and that history will color how things go as this disease progresses.
Right.
For example, my father and I had a very contentious relationship. We would argue all the time. We would, you know, we are of Italian descent, and we would sit at the dinner table at night. My mother would put a beautiful meal on the table, and we would sit and eat and fight and love every minute of it.
Right, so that was normal.
That was normal. And so when my father headed into his dementia, and he was 99 when he started, and then he passed on at nearly 104, the relationship on occasion was still contentious.
Right.
And he would say things, stop doing that, and I don't want to watch that, and well, but Dad, everybody else wants to watch it, or I don't like this, you didn't cook this right. Well, that's all I have, that, and we would go back and forth.
Right.
But that was normal.
Right. But I think this is really important to emphasize, because many people have this vision that if you become demented, you just sort of coast out. You know,
No,
that you're really sort of all of your emotions are dampened down, and
Right.
you're just sort of like sitting there
Right.
in a chair.
And it's not that way. You know, after my mother died, my father's dementia progressed. He was obsessed with where his wife was. And one night we were sitting in the living room, and you know, I think one of the things that really is most difficult for family caregivers is the repetition. So it had to be every 30, 40 seconds, my father would ask me the same question. And I would give him the same answer. And he would ask me, where's my wife? Where's my wife? And finally, one night, after having asked me this at least 25 times, I was very frustrated, and I turned to him and I said, Dad, are you talking about Pauline? And he said, no, I'm talking about my new wife. And I said, do you mean you got married and didn't invite me to the wedding? And he laughed. So that was kind of a way of diffusing it. But it's those kinds of interactions that I think for some family caregivers become very problematic. You know, yes, I have a background in dealing with people who are experiencing some sort of mental disorder. I think that helps. But even if you don't have that background, I think you have to kind of lighten up.
Right.
That would be my advice. Talk to yourself, use humor as
Right.
much as you can, because it's very difficult to see this disease take over someone's personality.
Right. Do you think people think that if people that have dementia that are exhibiting that kind of repetitious behavior, contentious behavior, that if they get on the right medication, it's going to go away?
Well, I think they think that, but I think that's magical thinking.
Well, why don't we talk about that a little bit? Because that must be a real driver for some of these medications.
I think what the medications do that are specifically designed for dementia is just slow the process down. And if you go to the webs, you know, WebMD or drugs.com, and you read about some of these anti-dementia drugs, that's what they all say they do.
Right.
They slow the process, but they don't change the process.
Right. I think that's really important. I mean, there's something to be said for slowing down the process, but that doesn't mean that the day-to-day behavior challenges that we're talking about
Right.
are somehow going to magically go away or even slow down.
Exactly.
So, do you think that the fact that you were able to maintain your parents, all three of them, at home for so many years, with help, with some other things that we've talked about in other shows about how the house was redesigned so it would be safe, etc. Do you think that one of your saving graces, and for your husband, is that you did have jobs, that you could get out of the house?
Absolutely. And you know, my husband has been retired for a while, so he was home with it much more than I was. The importance of getting that caregiver in there to take care of both my mother-in-law and father was not only for them, but it was to give my husband respite.
Right.
Because, you know, this is, you know, a great part of our lives. And even though we made this commitment, I was out at work in the daytime,
Right.
and he was home, and he likes to play golf and do things like that, and he needed the freedom
Right.
to do some of that. One of the things you learn when you assume the responsibility of a family caregiver is that you cannot live a life of spontaneity anymore. You have to plan everything. So if you want to go on a vacation, you have to sit down and plan with your caregiver and make sure that your vacation days coincide with when she can be there, or that they match the days that she is there. And then what are you going to do on her day off? Are you going to bring in an agency, or can she find a substitute? I mean, you have to plan everything. When you assume the role of a family caregiver, you don't sit home at night and say, oh, let's go to a movie.
Right.
You have to plan it.
Right.
And so if it it's not wearing on you very much to live a more planful life. And if you have the resources to get help, and we used my father's Social Security money and my mother-in-law's Social Security money to support the help.
Right.
Because that's what it's for.
Right.
So they had this small resource. We put some in, and that's how we got through the resourcing, the family caregiving, the caregiver who came from the outside to give us respite and to take care of them.
Right. Well, I think for those that are listening who may be trying to do it all, do you think it is possible to be a full-time caregiver, or is it just really an unrealistic expectation?
Well, Nancy, there are so many people that are, because they might not have the resources, or maybe the Social Security isn't there, maybe the person never worked.
Right.
And what people spend out of pocket when family caregiving in this country is staggering. It's over $200 billion. And what they give up, and I think there are many people that just see it as a part of life, and there are others that may feel very robbed and frustrated by the whole thing, but this is their, quote, lot.
Right.
And this is what they have to do in order to maintain. When you look at the number of family caregivers in this country, if you go to the AARP website, the American Association of Retired Persons website, it's staggering. It's millions and 21 million people doing some form of family caregiving. On the one hand, that makes me feel good that people are assuming their responsibility, they're taking care of their loved ones. It's a good sign. But there are other countries that I think have done a much better job at setting up systems to support families when they are facing these challenges.
Can you give us some examples of that, Gloria?
Yeah, I think that in England, they maintain people in their homes to very advanced ages through kind of a community visiting system. They have systems like that in Belgium. In the Netherlands, they have systems like that. It's sort of an aging in place philosophy.
Right.
Instead of putting people, quote, as my parents used to say, don't ever put me away.
Right.
Instead of that, there are these systems in place to really kind of keep the elderly either in their homes or closely embedded in the community. I don't think we figured that out yet.
No.
Maybe we're too young a country. I don't know.
But we better start thinking about it soon, because we're getting so many numbers of people that have these challenges that alone is overwhelming.
Right. I think the other thing that family caregivers really need to consider is finding someone, maybe it's a counselor, maybe it's a priest, a religious, a therapist, someone they can go and talk to about this situation on a regular basis.
Right.
Because it helps you to process it when you have an objective person who is sitting there, and I did this for 10 years. When my parents first moved in, for 10 years, I saw a therapist. I went every week. Now, that's part of what you do when you're in my field, but I went for myself.
Right.
And I think it's important that you allow yourself the luxury of finding someone to talk to, helping you to process your experiences, to reflect on them, and it helps you to get through, I think, in a much healthier way.
Right. Can you give us some examples of how that therapist helped you?
Well, I'm very hard on myself.
Oh, really? Yeah. I think it comes with the territory, doesn't it?
So I remember one night going to see my therapist, and he said, are you upset about something? Gloria, you look unusually. And I said, yeah. I said, my mother was sitting in the chair when I got home, and I sat down, and I said, "Hi, Mom." I was on the ottoman in front of her, and she kind of looked at me suspiciously. And I said, "Mom, it's me. It's Gloria. Do you know who I am?" And she kept staring at me. And I said, "Mom, I'm your daughter. Remember, I'm a nurse." And she said, "Big deal." And at first I laughed, but I was sitting in the therapist's office and I just started to cry.
Right.
Because my mother didn't know who I was,
Right.
but she knew my mother-in-law. Because my mother-in-law was with her all day. My mother-in-law insisted that my mother did not have dementia. And I finally figured out why, because my mother-in-law would talk to my mother all day. She would tell my mother all her stories.
That was fantastic.
My mother never said a word. She didn't respond, but she was apparently listening because she always remembered my mother-in-law's name, but she didn't remember mine.
Right.
And so that's upsetting.
Well, it's a loss.
Yeah, it's a loss, exactly that. And I think that's, for me, what the therapist helped me with.
Right.
The loss, the pressure, the lack of spontaneity, the having to plan everything, the frustrations, the worrying about health problems. And so I had a person to talk to that would help me every week just to reflect and not be so hard on myself.
That's right. Well, that's really beautiful, and I think it's great that you shared that with us, because again, so many people think that if you're a trained person, you're a doctor, you're a nurse, you're a therapist, a psychiatrist, you can name it, that somehow you have knowledge, and because you have that knowledge, you don't have the same emotional needs. But I think that Gloria has told us that it doesn't really matter. It has to do with the experience, and everyone needs someone to process that experience with. And if you don't have a therapist or some close person that you can talk to, perhaps you can use your church or your synagogue or a friendship network. You really just have to build that into your world when you're dealing with such demands on a day-to-day basis. But the other thing that I heard in that story that really sounds quite delightful, and again maybe was one of the unanticipated consequences of having 3 elderly family members, all of whom knew each other very well in the same household, is that it sounds like they gave themselves group therapy.
Well, I'll tell you, they were very close. And even in my mother's very severe dementia, she always reacted very positively to my mother-in-law. My father and my mother-in-law became very good friends, and my mother-in-law would watch out for him. And of course, my father was very protective of my mother. And that was kind of, good for us to see and experience. The relationship between the 3 of them was always very positive.
Right.
It was the cross-gender relationship, the father-daughter, the son-mother relationships that sometimes got a little contentious, but that's normal.
Right.
I was giving a talk one day at a meeting and on this very topic, and after the meeting, a nurse came up to me and she said, I'm really glad I came to hear this today. And I said, well, good. And she said, my mother lives with me, and my mother has severe dementia, but I never talk about any of the things that she does.
Meaning doesn't talk to other people about it?
No, she never talks about it. And she said, I came home one night and I found all of my clothes and my belongings had been taken out of my room by my mother and put on the dining room table.
Interesting.
And she said, I sat there. She said, I was very frustrated. I was very angry. I spent 2 hours putting everything back, but I never told anybody until now.
Really?
And I said, well, you have to talk about these things. You have to share them with somebody so somebody can give you a little perspective on what's happening, or just be an ear.
Right.
To hear you, because I hear you. I experience things
Right.
like that.
Right.
And it's important for you to talk about
Right.
it.
Well, that's what we're hoping that these programs will do for you, is really to decrease the isolation, because isolation can ultimately make you crazy. And the only way to really dampen that down yourself is to get support. And so that has to be as purposeful, getting support for yourself, as it is for you getting services for the people or person that you're caring for. So that's a beautiful illustration of that. I mean, when you think about it, if you're on an airline, they always say, if you have the oxygen masks come down, be sure to put yours on first before helping anyone that you're with, a child or another person. Because if you're not really sustaining your oxygen level,
Exactly.
you can't help anyone else. And you are going to be, having major health consequences yourself. So perhaps in that day when you were giving a presentation, you really helped that person.
I hope so. I hope I did, because I cannot imagine what it might be like assuming the responsibility of family caregiving alone.
Right, right.
I always had my husband there, and we would go back and forth, and we would get a little help and get a little respite in the beginning, and then my own kids would come over sometime and kind of sort of soften everything, because when the grandkids were around, it was a different dynamic. It was
Right.
very positive for my mother, my father, and my mother-in-law. So I was very fortunate. I had a husband I shared this with, and I had kids that would come and grandkids, but there are many, many people out there that are going it alone.
Right. And if there's one thing that you take away from this discussion today and this program, is that not only should you not do it alone, but you don't have to do it alone. A lot of that reaching out is really going to have to do with you, and really finding the resources that are going to work for you and in your community. So much of this really takes a village, and the village starts with this conversation. And hopefully, in listening to this, you will reach out to other people that will help you. So I want to thank Dr. Donnelly again today for sharing her heartfelt experiences and really helping us to process that, so that with her lessons learned, you can learn some of this and use it for your caretaking as well. So today we really have talked about the history of relationships. So if you're caring for someone with dementia, when their filters are gone, you're going to have some of the same family dynamics. They're not going to go away. They're going to be reinforced. They may be more exaggerated in some instances, but you're going to be really sort of locked in to some of those same relationship dynamics. And I think the second point is that caregivers need to forgive themselves. You didn't cause this problem. You're really taking care of this the best way you can. So anything that you're doing is better than nothing. And so you really should reward yourself and not be so hard on yourself. You're going to have positive and negative emotions to some of this, and you're just going to, as we heard, go with the flow, use humor, and use other people to support you. Then we also talked about, with AARP, you can go on that website and see how many other people are in your shoes and how they use resources, including prayer in some cases,
Yes.
to really help and reinforce and to get through this phase of life, because it isn't going to last forever. And whatever period of time that you're engaged with this work, it really is meaningful, and you are making a tremendous contribution to your family members. And I want you to leave with that thought in mind, that what you're doing is really very positive, very worthwhile, and is really something that will really help you in time, even if it's frustrating at the moment. So again, I want to thank you, Gloria.
Thank you.
It's been a pleasure once again. We're going to have more in this series, and I hope you will join us. So remember, with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today, and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.